Thank you. We are going to shift right into the next panel. If anyone feels that they're too stagnant from sitting and they need to stand up and stretch, that's fine. Not you, Karen. So I would like to ask the group of moderators that are still here to come to the podium. Winston, David, Jonas, is Julie, did she step out? I think, oh, right there, okay. Colleen, who am I missing? David's coming in. All right, so the drill here.
Wow, we're crowded up here.
So we can scoot down. So thank you for those who remain. We will be done before long. The exercise that we will do to conclude this, as I've mentioned a couple of times already, is I will volunteer a couple, and then I'm going to ask the folks who have moderated and sat through all the sessions to reflect on what they have heard or thought they heard and share what they thought were the 2, 3, 4, 5, you got to be able to count them on one hand though, major points that you're going to take away from this. So to get it going, let me share some of what I heard. The first of which has been repeated multiple times, and that there will be more fire disasters in the future. That's part of what we can look forward to. And while it has been said multiple times and is perhaps not terribly clairvoyant or insightful, to repeat that is probably worth making clear, because that certainly will be reflected in our report. I think a second observation that I took away from this is that this whole idea that wildfires initiate a cascade of both environmental and population health effects, that they're not single events that happen and then are done, but whether it's the effect on the water systems or the debris flows or the mudslides or the other things that follow, whether it's the myriad different health effects that we spent a lot of time talking about yesterday. And I thought the conversation about the potential intergenerational effects is something that obviously needs additional work, but the results that were presented were fairly compelling. That's something we should certainly be thinking about, that relatively short-term single exposures can actually produce long-term and intergenerational effects. I guess I had a very long list, but I'm going to just call out, I think, 5 things. The third thing is I was impressed by the fact that we don't know much more than we know. That there are so many areas that are begging for research to be done, to establish the databases, to even establish the research infrastructure so that research can be done. I was particularly struck by, because having been the state's top health official for quite a few years and issuing many of these advisories about what we should do in the face of wildfires and other things, how meager is the evidence base upon which those recommendations are based, and the fact that we really do need a substantial amount of work to determine the effectiveness of these public health interventions that we recommend. I don't think we could not miss the point that was made in so many different ways that disasters in general, but certainly such as the wildfires, expose the disparities in the safety net and public support systems, and really unveil the structural biases and inequities that are embedded in our systems and in our response and recovery mechanisms. I think what was particularly striking was that the number of ways, whether from cell towers to transportations to funding to housing, I mean, it just goes across the board how deeply these inequities are embedded in how we respond to disasters. And while that has certainly some negative and depressing complications, I also was somewhat encouraged by what a number of people said, that these also provide opportunities to re-engineer these processes and reimagine new communities, and the opportunity to really redesign the system absent those inequities and biases. And then the last thing perhaps is the cultural and policy approaches and responses to wildfires and smoke exposure for vulnerable populations are not equitable for things that have been put in place to deal with other problems affecting those same populations, whether it's pesticide exposures or heat exposures. Smoke exposure somehow missed the bus along the way, and there's obviously some work that needs to be done to try to at least achieve parity with some of the other areas that have received attention in trying to address these problems. So with that, let me stop. We'll just go down the line here unless someone has something that they can't wait to say before we get to it. But Wayne?
Thank you, Ken. You're always so elegant at summarizing things that I feel like I don't have anything to say actually here, but I'm going to reiterate some of what you said, but in a little bit different way. First of all, I've also got 4 things. Maybe I'll add a 5th one to start with, which is, because it actually was my first one, which is that we need to broaden the learning in this area. I mean, we need to, I feel like we scratched the surface. I learned a huge amount, so I think you successfully did broaden the learning here, and I want to thank you for the wide multidisciplinary input that you had and the team that actually put this together. I know sitting on one of the roundtable groups, and this one involved 4 different groups within the National Academy, that in itself is a challenge, and then the time period that you had to put it together was very short. So I just want to congratulate you, and again, thank you, the staff, for actually a fantastic job, because I learned a tremendous amount. So let's continue to broaden that learning. I think we need to do that. I tried to bring in my perspective from the VA and the DoD that I've had. For example, I'll add one thing. We've trained now, and the DoD has trained 6,000 providers in something called battlefield acupuncture, which is what you can treat pain non-pharmacologically, which they're using now out in the field. That's a simple thing. You can learn it in 4 hours. There's lots of examples like that. We heard that we really need to broaden it in the community, and many, many people spoke of that. We need to bring the communities themselves really into the heart of the discussion, both in terms of these meetings, I think, but also in terms of the development aspect. And the videos helped us to see that, but it would be great to have that even expanded. Non-medical providers, you know, we keep thinking of this as a public health or a medical framework, but there's lots of people out there that are providing the support that's necessary. Faith communities, we heard about beauty shops, there's something called trauma-informed yoga providers that are out there, et cetera, as well as folks from communities that have experienced these before and have bounced back and now are really know sort of what the issues are and can be assets in those areas. I think the second thing is that there needs to be a huge focus on how we do cross-silo integration. Integration is in a specialist environment of knowledge becomes a great challenge. And we see this in many areas: data, education, risk perception, leadership. We need meta leadership that's able to go across silos from agencies, because if I'm in one agency, I focus on that thing, but who else am I talking to that needs to be at the table at the same time responding? I mean, this kind of network response that Michelle described, I think, is a tremendous emergence of that kind of meta leadership, and we need to see more of that. Maybe we need a new profession that is just on integration across silos, that is trained just to do that and given the authority to do that. You sort of see this emerging in healthcare, where there is also disintegration across systems. We see now health coaches and care coordinators and navigators and everything, all focused on trying to get the system to work better. And I think maybe we need something like that, perhaps MPH or PhD or something just in system integration in those areas whose role is to do that. I think the third thing is and you said this around the social determinants. I'm struck how over and over and over again, no matter what meeting I'm in, when we're talking about where's the ROI, where should the investments go, it's the same underlying social determinants that hit everything. I was just at a meeting at the British Embassy before I came here, where they're trying to use something called, actually the US has a version of it called the Area Deprivation Index, where they're now able to map. This is out of the University of Wisconsin, where they're able to map vulnerability components down to the neighborhood. We're talking about, less than 1,500 people, and use that in triage and risk management, in resource investment, et cetera, in those areas. And when I was looking at some of the factors that go into this, they're the same factors that are in the deprivation index in those areas. So we should be using things like that. We have to go further and further upstream. That's a known principle in social determinants, and upstream has two different meanings in my term. Upstream in terms of the social determinants like we've talked about, where are the factors that actually allow for appropriate behavior change, recovery, resilience in those areas, and where they're not. And with the data, the amazing data from the macaque monkey colony, it even goes even farther upstream, because now we're talking about the children of the macaques that were exposed early on when they were young. So we not only, so the definition of somebody who's between 1 and 6 months, the vulnerability of that population is not simply the vulnerability of them uniquely at that time. It actually passes on to multiple generations for their entire life, and even to their grandchildren. I'm thinking about that's especially important upstream from a life cycle area that I think needs to be protected in those areas. And then the final thing is just this reframing you mentioned. There has to be a reframing in this area, and we saw examples of reframing from putting out fires to adaptation, to fire adaptation in those areas. I think the fundamental reframing that's needed across the board is one from deprivation to asset-based. Deprivation is a medical model approach, a professional approach where we're going in and saving you. You have needs, we're going to come in and provide services to do that. And what we've heard over and over again is that communities have resources, they have learnings in those areas, and actually they know what they want more than any amount of data can actually provide. And so we have to turn it on its head, provide power to those communities in those areas. And there's some great examples of that. 2 days ago, the 100 Million Lives program at the Institute for Healthcare Improvement just released something called the Wellbeing in the Nation Index Framework. And this is a positive social determinant assessment, okay? Not a negative like the deprivation index, but it's actually where are the assets in the country and how do we actually build those together across silos. I think a community development framework instead of a medical framework is what we're talking about. And there's a number of examples where if you're able to create the ability for communities to now solve their own problems together, collectively, that the ROI on that is huge. Examples from England and other places show 1 to 15 return on investment just in the health area, if that framing and that model occurs in this area. I was struck by Ann Schmidt's comment that goes along with it, that this is not a fire issue. This is a resilience issue. And if we could get that in our head, and David Shaw re-mentioned that, the long-term folks mentioned that, the idea that you could create a learning and self-care community and focus on that, I think that kind of reframing would go a long way in getting us the ROI that we need.
I was taking notes. That was very interesting. So I'm going to add a few. I agree with everything that's been said. I'm just going to add some 4 points. I think they're mostly focused on what I heard during the session that I moderated with some salt and pepper from other sessions. So I found it really interesting. One of the takeaways I have is that wildfire really is unlike other hazards that we typically study in the disaster realm. And that one of the differences is that we are talking uncontroversially today about preparing for the return of fire to our ecology and to our environments, which is unlike the way we talk about other hazards, which is really about keeping it at bay. We don't invite flood. We don't invite tropical storms. We don't invite all the rest of the hazards. So I think this, Michelle mentioned taking this to a new paradigm. I think this bears a lot of face value. And I think it also opens up some fascinating challenges, as was mentioned, about how do we deal with this? How do we do this in communities that are recovering and now have to shift their perceptions on this? I think wildfire is also is unlike other hazards, and as we mentioned, there's cumulative exposure. There's a sort of silent, ongoing potential for cumulative exposure, whether it's repetitive events that are distant from you, or it's prolonged events of 40 days and 40 nights. It's unlike other exposures and that other hazards that way. And I would mention that we didn't talk about indoor smoke. Now, most people spend 95% of their days indoors anyway. And all the measurements and exposures we heard about today, or the last 2 days, were outdoor exposures. So we do need to develop the science of indoor exposure assessment and bring that into our public health models of causes of disease. And lastly, it's an interesting hazard because it occurs in a place which offers opportunities for recovery, that is the forest. And people move to the forest for its joys, and there are opportunities therefore for the same thing that's causing you a hazard, giving you an opportunity for recovery. Which then means it's also a model potentially for living with climate change. We're going to see the same sort of ideas percolate up when our shorelines start to be overcome by tidal increase, by sea level rise, just for instance. So thinking about this field that's really evolved as a model for other areas in climate change. Second point, I think we've talked a lot about location of the wildland fires as somewhat different, mainly because it's occurring often in under-resourced rural areas. Of course, it's affecting urban areas too, but the focus we've had the last 2 days on under-resourced rural areas is really important. This goes to the equity issues and social determinants of health issues also. I think there's a fascinating statistic that suppression only accounts for 9% of the costs, whereas the recovery costs was accounted for 65% of costs in that one study, and that the locals bore 46% of those recovery costs. So I think we really need to bring that in. That's a very different approach, a set of facts for the hazards world. Lastly, I think on that point, the opportunities for addressing structural inequities at local levels in recoveries, there was a question about that. I don't think we really heard about how that can be done, and I think we would like to see models of how these structural inequities can be addressed in recovery plans in communities. And this might be an opportunity for equity researchers to actually get involved in promoting and facilitating those conversations in communities. And I'd like to see those worlds mesh better. Number 3, I found a really interesting disparity between community as a recovery as a community process that really dominated the conversation for a day and a half, and how we are dealing with it as a nation and scientists. I will point out that no research on recovery was presented today, in the last 2 days. I mean, there may have been statements made based on recovery research, but I didn't see any citations to my memory. I mean, recovery research and disasters has been historically difficult to do, but the fact that we have so little research on recovery and wildfires is a glaring absence. Just 2 topics that came out in my session that I moderated, was the challenges of a receiving community. We were talking about rather small communities there, but there are lessons for receiving communities for much bigger events, catastrophic events that can occur in the United States, where we'll have much larger displaced peoples coming into our communities. And we should really be thinking about that. We had National Academy of Sciences meeting around nuclear war again last year. It's because it's become more and more possible in the last few years with weapons that we could actually live through now, synopsizing in the meeting. But there we will have huge amounts of displaced persons, internally displaced persons in the United States. And there's obviously huge differences in scale, but the idea of conflicting and community, the challenges of receiving communities, we should take that opportunity to study that. It may give us a lot of data for the future. And then the role of universities and colleges, we heard about them through Nicole's work. We heard about it today through what Chico State is doing, and I think that's something that really needs to be written about and developed. And then widely, just sort of a more meta lesson that I took, we have fire researchers, practitioners, community organizers, public health, disaster researchers, even some climate change people. We have health equity, we have population health, all in the room. And I think I've seen a new approach to disaster research and in public health and well-being as a result of this. And I would hope that the national academies might think, or others might think about how to tap this kind of transdisciplinary energy and move forward. Much as I love the med prep form, and I'm not throwing it under the bus, I think it's great. We serve a different function, and I think we have a different kind of function we see coming out of today in the last 2 days. Thank you.
Thanks so much. My name is Shuli Baldwin. I'm the director of the Center for Health Equity Research at Northern Arizona University, and I'm a member of the Roundtable on Health Equity and helped with the planning for this workshop. And I first just want to thank Ken and UC Davis, the Roundtable members, the Planning Committee, National Academy staff, our sponsors, et cetera, for organizing and supporting this workshop. I think it's really been an amazing 2 days of presentations and discussions, and I really want to thank the presenters for sharing their stories, experiences, programs, best practices, research, and lessons learned with us. And my heart really goes out to everyone who's been impacted by these wildfires. I just want to commend and thank all of those people that have been involved in the preparedness, response, and recovery efforts. It's really been quite a powerful impact on me in terms of hearing all about this. And I'm from a neighboring state in Arizona. I think we're facing many of the same issues, and in fact, we are planning a similar symposium in November with our Center for Ecosystem Science and Society and our Center for Health Equity Research that will be focused more broadly on climate change and its potential impact on populations and communities in Arizona. So I hope there might be an opportunity for some of you to attend that, and I may invite some of you as speakers too. But in terms of lessons learned the last couple of days, I'm not going to sound that original because I have similar thoughts as everyone else, but I think that there have been some really interesting discussions about thinking about new paradigms and what is the new normal or just the normal now. And I don't think that we can operate in silos when we're facing these very systemic challenges. How do we take more of an upstream approach, as has been said, in terms of prevention, looking at both environmental and resource management sides with controlled burns, thinning, restoration, as well as the population health side of things in terms of preparedness. I really appreciated Don Henkin's viewpoint yesterday as Indigenous thoughts about reclaiming a culture of fire and thinking about traditional fire back on the landscape, and I'd like to look more closely at that. And with Michelle's talk today as well about a new paradigm in fire adaptation and all the different models that she presented that seem to be working really well. So that was the first point. Then the second point, again, it's already been said, but looking at preparedness, response, and recovery through more of a health equity lens or perspective, and that was talked about a lot yesterday as well as some today. Leanne talked about that, connecting health equity with disaster work, and how do we, at this point, a lot of our plans are not in place for helping the most vulnerable populations. And so how can we do that? Genevieve's also talked about that too, that many people could not even afford to evacuate. So we have to think about that much more carefully in terms of the preparedness, response, and recovery. Also, Oscar had some excellent points. One of the quotes he had, which I loved, was he said, disasters veil gross inequality that exists in our communities, and there's unequal distribution of response and recovery. And another thing that Genevieve commented on was language accessibility issues, and especially here for Indigenous speaking migrants, and trust issues for those who might be undocumented, and major fear in even trying to access services, concerns about immigration rates. And so we need trusted partners to be able to communicate this information. And so then finally, I guess the third point I would make, I think that there were some wonderful discussions about potential strategies and solutions. How do we come out of these silos and collectively work together? How do we create resilient communities? And so some of the comments that were made were the importance of working together across sectors, bringing in the people that are most impacted to hear their stories and perspectives, trying to co-construct meaningful solutions over time, fostering relationship building, increasing language access and enhancing how messages are communicated to reach all people in our communities, the reframing of issues and collaborative planning. Today it was mentioned gathering, honoring, and integrating local and cultural knowledge and mobilizing communities.
Wow, I have to follow that. My name is Colleen Ryan, and I'm going to try and stay within my lane here of, I'm the chair of the organization and delivery of burn care of the American Burn Association. So I'm a burn surgeon from Boston, and I'm here as part of the forum. I'm incredibly grateful to have been invited to this conference. It's been an enormously informative experience, and I have 3 points, basically. Some of them reiterate what's been said by my previous panels here. The first gauntlet that has been the glaring gauntlet is really the organization and design of the delivery of the recovery efforts must address the intersecting vulnerabilities of the population. Clearly, race, ethnicity, age, gender, language, disability, and then once the event hits, the community has experienced a trauma, and then this trauma must also extend to the receiving communities. So all these people are stakeholders, and as the NIDLR, which is the National Institutes on Disability Independent Living and Rehabilitation Research, which funds some of my other things, has the motto, "Nothing about us without us." And I think the stakeholders of the survivors and these things need to be in these meetings and part of this. And how could they be involved? And some examples of how they could be involved in designing the recovery process as part of the trauma system that we talked about: bystander, first response, hospital care, rehabilitation, and recovery. For instance, each of these stakeholders could look at the languages of the bystander care and beforehand cool the burn. That could be looked at and translated in all the languages so that, you know, by Twitter or by whatever sort of dissemination science or whatever message that wants to go out, it can be delivered in all the appropriate languages or with all the appropriate cultural meanings. And those sort of using dissemination sciences, those sort of things can be optimized. Another thing is recovery resources, things like how to tell your child about the trauma. You know, what to do with the television of all the fires on every single show. I mean, burn children, we know, have a lot of difficulty watching TV with every single show having a fire on it, even the cartoons. And, you know, this has been an issue in our population for a long time. And, you know, these sort of resources for what to tell your child, there's no reason that can't be prepared beforehand. And with these communities at the community level, these sort of resources should be pushed out immediately so that each community doesn't have to reinvent it every single time. There should be policies that snap into place that are pre-figured out beforehand, once things like rent control and that sort of thing that can, when a fire happens, just can snap into place. Survivors need to be involved to really determine what is important. So many of these things are value judgments, such as, you know, how many parts per million of benzene are you allowed in your water to make it safe? Is that more important than, you know, putting food on the table? I mean, it's like, you know, it doesn't matter what you know, numbers we put in front of them. Futility and what is meaning is up to the person. I mean, that's the free society that we live in. So number two was basically the burn problem. And Dr. Palmieri brought that up. I mean, there's 300 burn surgeons in North America. Burn beds are limited. Burn nurses are limited. Burn staff is limited. It's clearly a bottleneck in the national defense system against, you know, maybe wildfires don't have that many burn patients, but, you know, one spark the wrong way and it could be a tremendous disaster. I mean, imagine 4 burn beds left in Northern California. You know, one other ember and it could be a problem. So we need the fragile, self-organized, unfunded regional disaster response system needs to be really codified by some sort of a national thing. And I think the current ASPR, Dr. Cadillac, is working on that, and we need to move forward with that. The concept of convergent science is incredibly important, and I think that's exactly what we need to solve this problem. And things like the inaccuracy in burn size determination, things like telemedicine and artificial intelligence. I mean, there should be a way that we could snap a picture and have the computer or the phone figure out what burn size is so that we can make accurate determinations with our burn size table that are going to make the clinical decisions about who's going to be sent here or there. And, you know, we need mathematical modeling by our economists on what's the best way to transfer patients here or there, which hospitals should be open, which hospitals should be closed. We need to have our engineers figure out, you know, burn surgeon in a bottle. How do we dissolve the wound? How do we better cover it? We need dissemination science to figure out better bystander care and better recovery care. We need to break down the silos between burns and trauma and EW and other providers to provide better education. How do we disseminate, how do we take a burn surgeon in Boston to guide a fireman in you know, or an emergency room physician in Timbuktu to do an escharotomy to save a limb of somebody in Alaska? This is what we need to figure out how to do. And then a lot of research questions. The one that has bothered me my whole career is smoke inhalation. Will somebody please understand the physiologic mechanism and get a dose response curve about what is exactly happening with inhalation injury? Because I think until we can understand the dose response curve and what it actually is, we're not really going to truly understand it. And last, the last gauntlet is really, we need to change the way we look at disaster. I mean, lessons learned, I mean, give me a break. I mean, we need to move that beyond to real science. I mean, we need to understand a conceptual framework for understanding disaster. If we can measure it, we can improve it. What are the essential elements of information to benchmark these disaster responses? They're happening again and again and again. Are we getting any better at it? What can we improve, and how can we measure it and improve it? Anyways, I really appreciate being here, and thank you.
Colleen, since she's maybe swimming in her own lane, but you must be doing medley stroke, because I think you hit on all components. And I wanted to echo Julie's points with regards to thanking the Academy of Medicine and our staff for really bringing different roundtables together that have different focuses, foci, and really modeling the kind of intersectional thinking that's required to really take some accountability for what our communities are going through and in suffering. So I think that's been a great success and maybe an opportunity for us to replicate in other settings. So being from the Roundtable on Health Equity, I wanted to really bring an equity lens to the discussion that we talked about over the last 2.5 days. And so I'm going to use this analogy, which I don't think is perfect, but I do think it does teach us something. And I did think about the Titanic, the actual event, not the movie. And if you look at the actual event, and I looked in this in Google, there were about 1,200 people that lost their lives. 62% of the passengers lost their lives. But very clearly, there was a disparity in terms of what class, what deck you lived on and during the crash with the iceberg. From what I understand, and this is what the current statistics suggest, if you were in first class, you had a 39% chance of being one of the people that died. If you were in the second class, you had a 58% chance of dying. And if you were in third class, you had a 76% chance of dying from that event. So the event occurs, the natural disaster occurs, but the vulnerability is not equally distributed. In fact, I had a colleague at Kaiser Permanente that was toying actually with looking at predictive models relative to what happened in the Titanic. And if you were, for example, a female and you were in the third class segment of the ship, you could calculate basically what the chances of survival were. And I think that's not a perfect analogy because we don't see as many deaths so far with regards to the wildfires, but it does suggest that there's suffering, but suffering is not necessarily equally distributed. And the suffering perhaps is more disproportionately burdened or borne by those individuals in the lower segments of our socioeconomic structure. So, you know, I don't think smoke discriminates. I don't think fire discriminates. But I think there's discrimination based upon housing access. I think there's discrimination with regards to FEMA support not being available to people who are who are undocumented or have serious misgivings about ICE. I think there's discrimination with regards to economic opportunity and resources for people to recover. And I think there's discrimination with regards to access to mental health and trauma services. And I think we need to seriously look at how there's disproportionate burden of suffering relative to these wildfires to the people who are not only in lower socioeconomic situations, but also in terms of the frail and the elderly. You know, we saw a number of slides that showed the big clouds of smoke, the plumes of smoke that not only engulfed ground zero with regards to the wildfires, but how they started to invade our atmosphere across hundreds of miles and affect millions of people. And along that stream of thinking, literally, is that those communities downstream, also they were suffering, and they're suffering based upon vulnerabilities. So if you're, you know, an inner city kid living in East Oakland, I think your chances of having a mask, your chances of having a safe place to go to, your chances of having a network to care for you, is probably a bit less than those kids that lived in a relatively well-sheltered townhouse, single-family dwelling in Walnut Creek. And so we have to kind of look at even that impact of something like the wildfires that goes much beyond the ground zero of where the event actually occurred. But specifically, I think some of the recommendations that came forward from some of our panelists were to really consider, and I think Colleen mentioned these aspects, is to incorporate the voices of those that are impacted, the most vulnerable, into planning and into recovery. We need to really look seriously at the undocu fund as a part of our fabric of planning, as opposed to a response that is totally reactive to a disaster. And as I understand, there's no sustainable funding for those things. It's been really opportunistic. We have to look at how to ensure that people who speak different languages have a different cultural perspective of disaster planning and indeed fires become incorporated into looking at how we plan forward. And we have to involve the wisdom of our Native forefathers and foremothers into the planning about thinking about wildfires specifically. Now, one last thing, and this has been an issue that I've mused about with a lot of colleagues, actually more in the foundation world. And it wasn't really, I don't think we ever discussed this explicitly. But it's kind of the elephant in the room, particularly in California. And this is with regards to how do you talk to populations that have been most impacted by wildfires north of Sacramento from a racial equity lens? Does it make any sense to talk about racial equity when we talk about communities that are largely white, some Native American, but certainly not representative of the rest of the diversity of the state of California that has a minority-majority population? But I do think there is this very perverted opportunity to talk about the kind of experiences that are communities that have suffered through the wildfires and their their common experiences with regards to how our systems have let us down and how we understand our shared destiny. And that's specifically around how do communities deal with trauma? And the trauma of a wildfire is not that dissimilar from the trauma of kids that experience gun violence in their neighborhoods every day, in my view. How do you deal with displacement? Displacement caused by wildfire or displacement caused by economic turnover and gentrification? How do you deal with a sense of institutional failure and systematic institutional irresponsibility or non-accountability for the needs of your community? And I think both communities, whether you're in an urban Los Angeles, in a Latino or African-American community, or whether you're in Richmond and you're a Cambodian kid, or whether you're a kid that's here in Butte County dealing with the issues of recovery, there is a sense that our institutions have failed us. And then finally, the question of the historical significance of events like this and the intergenerational trauma that occurs. Because I don't think it just ends with that child or that parent experiencing it, but the storytelling and the narrative that is forthcoming about how we lost our homes, how we felt displaced, how we lost our sense of belonging. And those are the stories and the fabric in which we actually can find a path towards healing as a state and healing with regards to understanding our shared destiny and, dare say, what it means to seek racial equity and racial justice. So, you know, I just wanted to see if that meant something relative to our wildfire discussion.
Thanks, Dr. Owen. So I'm Michelle Bell from Yale University, and I'm going to talk about scientific research on human health and wildfire, and I moderated a session on the research challenges for human health. So I just want to make a few points from what was said during that session and also just a little bit of my own thoughts. So just the overall basic conclusion was that we have some limited but growing evidence that wildfire, smoke, and other forms of environmental contamination from wildfires are very harmful for human health, but there's some conflicting results in the evidence and more research is needed. And I always say, my husband always teases me because I always say more research is needed, but in this case it is. But I want to take a minute to talk about why is this really important, because we've talked primarily at this session, and including our concluding thoughts today, about the most horrific extreme disasters where people are losing their homes, people are dying, and so on. But when we talk about the human health aspects of wildfires, I want to point out that we're talking about something that's even bigger. We're talking about communities that may not make it into the news, maybe schools weren't closed, but you know, the smoke traveled downwind and they were still exposed to higher levels of air pollution. And those communities, maybe not in a disastrous way, but they were exposed as well. And this is important because if we really want to understand the overall impact of wildfires on human health, we have to include everything. We have to really understand the overall human impacts. And part of why this is important is to understand the human health impacts. And if we understand the science, we can help save lives and reduce the public health burden. And it's also critically important from a planning perspective, because if we want more resources to be given towards addressing wildfires in any of the capacities that have been talked about today, then to really understand the economic burden, we need to be able to sum up these various different impacts that are happening. Loss of school days, loss of work days, hospital admissions, and mortalities that are happening, not just in these horrific cases that we've been hearing about where people have lost their homes and lost their lives, but also, you know, communities downwind where, you know, elderly people are being hospitalized, due to wildfire smoke from communities where maybe houses didn't burn down, but they suffered some very, very levels of extreme air pollution. And the research is showing that that is happening as well. So the problems of wildfires on human health are actually larger than what we just might think from watching the news. So the bad news that is actually worse. But the good news is that people in the scientific community are wanting to look at this. So what were some of the challenges that were highlighted that people are working on? It's really hard to estimate your exposure to wildfire smoke or to any different type of contamination from wildfires. There is no monitor in the world that can estimate just your exposure to wildfire smoke. It can pick up a given pollutant. And I won't go through the details, but people talked about a variety of different methods. So the good news is people are looking at satellite imagery, chemical transport models, and a variety of different methods, each of which have their own benefits and limitations, and statistical ways to fuse those different methods together. So, you know, the findings are on the way, we hope, with ways to look at how to estimate what are we actually being exposed to. People talked about the need to look at other health outcomes. The research to date has focused on hospital admissions, that's what my own work has looked at, and mortality, but we talked about the need to look at other work. We had someone, Dr. Reed, talk about her work on birth outcomes. You know, we need to look at low birth weight from mothers who were exposed to wildfire smoke during pregnancy. We've had a lot of talk today and yesterday about mental health outcomes. This is a pressing need to look at people who were exposed for things like PTSD and also maybe some more subtle mental health outcomes. And there was even a session in one of the videos from a child who had lost her home and talked about what it meant to her at age 10 to lose her whole room, and she was 15 at the time, and it still really affected her. So I think there's a lot that can be done for many of these other health outcomes that are more difficult to study. We also need to look at some different types of exposures beyond just the smoke from wildfires. To date, that's what a lot of our work has been, but as we all know, there are many other types of environmental contamination that could affect us as well, such as mudslides, such as water quality, and such as many of the other long-term exposures. So those are some of the areas that I think our field needs to go in. And then just following up on what Dr. Wong and others have said, we need to look at issues of environmental and social justice. And I want to highlight that, you know, people have said that wildfires and wildfire smoke doesn't discriminate, but we have some very unfortunate patterns in disaster response. But I want to mention that these issues of how of environmental and social justice don't just start at disaster response. If everyone in America was exposed to the same level of an environmental contaminant, their human health responses would be different. It works that way for other forms of air pollution, and I see no reason why wildfire smoke or other forms of wildfire contamination would be any different. We see this for people from different socioeconomic status, different age, like children and the elderly, race and ethnicity, and we see this mattering on both an individual level and a community level. So even before we get to disaster response, even if that issue was somehow magically fixed, and no, I don't know how, but we still would have differential patterns in the health response. And this is really critical for our medical and public health communities to know that even if the disaster response were somehow made equal, we still would have people who, due to their baseline health status, their compromised health status, their occupation, their access to health care and other factors, may still have a more severe response to those contaminations, such as wildfire smoke or water quality from wildfires, than would other populations. And that's an area of active research where I and the panelists who spoke yesterday think we need a lot more research to really understand what communities and what individuals need our attention. And then just my final thought, I just want to say that one thing I really enjoyed about this meeting is that this forum brings together people from a wide mix of different backgrounds. And I'm more used to talking to people in my own field and people from, scientists of different disciplines. That would be like a broad-based meeting for me. But here we had medical and healthcare professionals, disaster planning, community organizations, scientists, government organizations, and many others with their different perspectives. And I found that very useful. I'm sure it will impact my own work positively, and I hope you all found that useful as well. And I also really appreciated that throughout the panelist discussions and the videos that we watched, that there was a constant refocus on the individuals and the communities and the different people for the actual pain and heartache that happens when these fires are affecting these people. So thank you.
Thank you all. We have a couple of minutes, not much, but a couple of minutes if there's anyone in the audience that would like to share their thoughts or their reflections. Yes, sir.
Octavio Martinez with the Hogg Foundation for Mental Health from Houston, Texas of Austin, and also on the roundtable for promoting health equity, and great reflections. What I want to share with you probably is conceptualize and what has been said throughout the last 2 days. But the one thing that's really resonating with me, and starting with the comment where disaster response science and research, for me, as I'm thinking about these last 2 days, needs to be part almost like we do in healthcare now, as we're looking at a continuity of care and really thinking of a more holistic approach where it's not just about health care, but it's also about health, where it really involves the social determinants, everything outside of the brick and mortar of the clinic that impacts an individual or community. And so I'm seeing the same thing with disaster and thinking about the wildfires here in California. I implore as we do the report, to think about this ought to be part of a continuity. And it gets to your point about the fact that we need to include and understand what exists in communities before disaster happens. And then, of course, we need to be worrying about the after effects of that. And so the research, science, and I think services, they need to come forth for our communities, keen on that, on translational research, as well as on implementation research. Would have been nice to have a couple of panels dedicated just to those to really help us to understand, though we can come up with great models and there's exemplars out there, well, we're not sharing them. We have this silo effect that really just, I think, diminishes our impact that we can have with our communities in ensuring that there are good outcomes for that. As an example, I'll give you as the Warriors Research Institute at Baylor Scott and White in Waco, Texas, doing some really great work when it comes to our first responders like our firefighters and also our active duty personnel in the military, where with the International Association of the Firefighters peer support training that they've given to firefighters and have now come up with an evidence-based approach that they're in the process of publishing. But the question is, who else out there is getting to have access to that information and to share it with each other so that we can take some of these exemplars and take them to scale where it's appropriate? And just want to iterate that I think that some of those concepts have been mentioned by the panel and our speakers, but I really want us to emphasize we really do need to work together as a community all together, because it really does take a village to make a difference.
Thank you.
Thank you. I feel like I need to add 4 comments because everybody added 4 comments, but I don't have 4 comments. But at any rate, thank you all for your reflections. And again, thanks to all the staff of the Academy for bringing such diverse roundtables together to really address an issue that, again, involves multi-sectorial types of responses. I'm Toni Villarreal, and I chaired the Roundtable on Health Equity. I'm from the Midwest originally and from the East Coast, and so this whole issue of wildfires didn't have a clue. And so we were discussing about, how does wildfires compare to, I was just in Puerto Rico last week talking about Hurricane Maria and the aftermath, and how does that relate to others? On where I live, this is just new news. I mean, you really don't understand what the impact of this is. And when you think about media coverage of the wildfires and who's affected, certainly the vulnerability of populations and communities we care about is not in the front and center. We heard more about the Hollywood homes, in Southern California than we did about displaced communities here. So I think, the opportunity to elevate and amplify the voices of vulnerable communities throughout is critical. I want to reiterate, I think, both through the disaster, the impact of the disaster, the recovery, and also the rebuilding, the opportunity to view this through a health equity lens can't be said enough times. The inequity, I think, as someone said before, is that the inequities that we have in our locations are the real disaster, and we have to attend by working with those communities. I think throughout the, again, efforts that we heard through speakers, I think a lot more can and should be done in terms of making sure that those vulnerable communities are reached. And I also think reaching out to the mainstream, some of the advocacy organizations for disenfranchised populations also need to be involved in this, because I'm not sure they're really aware of what the needs are of these particular community. I also think we just scratched the surface in terms of what communities and vulnerable populations we were talking about. It was in passing, somebody made an issue, talked about prisoners involved in the recovery effort. And that to me raises all sorts of issues like, well, was the prison on fire? Did they volunteer? They're also a vulnerable group. So, what are the health effects on prisoners? I think we have people here from the Veterans Administration, and I think there are veterans hospitals and services that are involved in many of those areas. So what was the effect on the veterans? How can and should the resources of the Veterans Administrations be mobilized? So I think we just scratched the surface, and I think we should be thinking about, so what are the next steps, both in making sure, and again, everybody has a responsibility here, an opportunity to talk about what they learned in their communities, to see how that impacts future efforts. And I think we as roundtables and as the Academy also need to be thinking about what are the next steps, either in promoting additional research, in using the whole arms of the Academy to bring attention to this particular issue. So thank you.
All right, thank you. We are actually at the hour. So I think we're going to call it a wrap. I'm going to make a couple comments. Maybe you can just bear with me for a minute, and then we will go ahead and adjourn. I would be remiss if I didn't once more thank a bunch of folks. Certainly want to thank the Planning Committee who worked so hard, thank the staff, thank the Academy for agreeing to support this without the usual sort of mandate and funding stream that goes with the workshops and the studies that the Academy is usually charged to do or that undertakes. That this was, as I said before, largely something that was determined to be important enough that the Academy, by bringing together the four roundtables and boards, pursued on its own. We did get some external support. We certainly thank the folks who did support us. Most importantly, thank you all for being here, and thank you for those who are not here, except perhaps in spirit, as well as those who are on the webcast or who have participated with us there. The two things I would note is that the webcast will be made available and will include all the presentations, most all of the video segments. There's a little bit that has to be edited out for reasons that aren't important to go into here. And that should be available within days or at least a short period of time, as opposed to the other product that will come out of this, which is a workshop report, which will be a written document. I would guess, based on the amount of material that was presented here, it will end up being 150 pages or something like that, maybe a bit longer when we include all the attachments. And that will be available in 8 to 10 to 12 weeks, something like that. I just see Karen and Kathleen cringing at that idea. I'm optimistic, but don't be surprised if it's 4 or 5 months from now. Before you see that, there's actually a lot of work to produce one of these. The recording will be made. We'll start working from the recording of all that has been said. That usually takes a couple of weeks. So it'll be a bit, but we will do our best to memorialize all of the suggestions and thoughts and good ideas that came out of these past 2 days. I would like to just give Karen Anderson or Kathleen Stratton the chance to correct any errors that I have made or any misstatements. Anything do we need to?
No, I just want to say that anybody who's interested in serving as a reviewer on the workshop proceedings, just let me know.
Right. Workshop as consensus studies, everything gets reviewed that comes out of the academy, and there will be a dozen or more or so reviewers that will be sent out for peer review when a draft report is finally put together. And that's an intricate part of the process. So with that, again, thank you all for being here. It's been good, and we'll look forward to seeing the final products.